I'm Ninez Ponce, and I am the director of the UCLA Center for Health Policy Research. I'm also the principal investigator of the California Interview Survey. I'm really excited today for this launch of data equity. But first, I want to acknowledge that UCLA Center for Health Policy Research, which is under the Fielding School of Public Health, is on Tongva lands. And so I acknowledge that these lands that we are on were the traditional lands of the Tongva and the Gabrielina peoples who took care of this land in the greater Los Angeles area and the Channel Islands. So welcome. I want to just quickly say that the Center for Health Policy Research is going to turn 30 next year. And those 30 years have been monumental for me and for many people who have been part of the center, and of course, for all of our supporters in the community. I also want to say that I started my career as an advocate, championing for better data, and we are not, data equity tourists. I think at this point, we are permanent residents and citizens in this space that I am just so heartened to hear that there's a lot of momentum, both from the, powered by community voice, but also from the federal government with Equitable Data Work Group and the Racial Justice Initiative under this present administration that has really helped finally get data equity on everyone's minds. Foremost, I want to thank our almost decade relationship with Tina Ko, Dr. Tina Ko from the Robert Wood Johnson Foundation, who in partnership on this road of better measurement and better ways of doing things to achieve data equity, that we've gotten to this point of creating this resource center for all of you to use and all of you also to participate in making sure that the needs of getting at the data equities that you have are addressed. So with that, I want to say that this center is to make it so for you, and I'm going to turn it on turn on and give the mic to Dr. AJ Scheitler, the director of the Data Equity Center. So AJ, hit it.
Hi, good morning, and apologies again for the challenges that we started with, but we are underway and happy to be sharing this very exciting work with you all. So thank you, Dr. Ponce, for the welcome this morning. She is correct that we have a long history in working toward data equity at our center. We know there's a lot of interest among a lot of other groups, both data custodians and data users. And so we want to reach into our network, share knowledge among all of our projects, learn from each other, and build the skills to help all of us raising all boats to improve data and move toward a much more equitable space. So today, I'm going to introduce the UCLA team. I'm going to go over the project that is the Data Equity Center. We're going to talk about some of the potential technical assistance topics that we are preparing to be able to tackle with you all. We're going to talk about the bench of excellent expert TA consultants that we have assembled to work with us in this process and who will be potentially working with some of you all through your challenges and toward your project goals. We'll talk about the application process in case your organization is interested in getting some technical assistance from us, and then we're happy to field any questions. So a very big thanks again to Tina Ko for helping us imagine what this center can be and what it can accomplish. And then I am joined by an excellent team here at UCLA. You met Dr. Ponce, but also you may see the pictures and or video of the rest of our team, Drs. Sue Babby, Tara Becker, and Riti Shimkata, who are also monitoring the chat and will be helpful in us answering any of your questions as we go along. We also have a wonderful bench of experts that are acting as our consulting partners on this project because they each bring in their own past experience, their own resources, their own tools, and their own shared desire to, again, help drive data toward a more equitable place across all types of data sets. And so depending on the kind of TA requests we get, we're going to be working with and leaning on a lot of these partners and tapping into the expertise that they bring to this project. So our main objective is to promote data equity by offering resources that are going to be widely available to all of you. And these resources are going to have a lot of different looks. They may be curated articles and publications. There are going to be tools and models that we may build as part of our technical assistance projects, or they may be training sessions that we're going to be offering throughout the course of this work that will be, again, broadly available both to participate in and or review later, so that we, again, can all share and be learning to address some of the different challenges that each of you may be encountering on the way to achieving your data equity goals. But we know that collectively down the road, what we want to do is create data systems that are representative, inclusive, and collaborative and available to the communities that you serve and that are represented in the data. This is the framework that we are working under because we recognize that just collecting the data is a first step, and there are much more points in the process that need to have a data equity lens to truly make the whole data set achieve the goal of being impactful ultimately in the communities they serve. And so our technical assistance and our resources are going to focus on all four of these components, from collecting to processing to analyzing to distributing the data, again, back to those communities that are representative, who may now not have data that they can really use to accurately understand the needs and the state of the current situation within their communities. And then as they move toward trying to implement programs to address health inequities, to have the data to measure whether or not they're making any progress toward their goals. And so we are very conscious of all of the factors that go into building an equitable data system. And so we are, again, with our team of consultants, preparing to address issues across all four of these domains. We are offering hands-on technical assistance. This will be, a limited scope. We will work together with you to craft. If you have particular projects that you're doing and feel like you could benefit from some outside eyes and some outside expertise to review with you what your goals are, what some of the challenges you may be encountering, and how we might be able to best help you to get over those barriers and move along in your journey toward your goals. We are prepared to take requests and to try to work alongside of you to make some real improvements. We are, of course, going to be throughout that process looking for resources or potentially needing to develop resources depending on what your particular issue is and how we're going to address it. And then we hope that those resources will be part of a very well curated library that will be available to everyone so that you can all benefit from the work that we do as possibly your organization encounters challenges that others have already encountered and overcome. So we're building a community with this, not just of individual projects, but of collective learning and collective improvement, shared knowledge among all of our data custodians and data users out there. And as I mentioned, we will be putting together training workshops. We may be doing some custom ones for certain organizations depending on their needs, but we may learn from some organizations that have common needs of some broad spectrum training that we can do, that again, we will promote through our center. And as we conduct them, we will invite folks to join, and we will archive them on our website for future use for any other organizations to avail themselves of. So we have been having preliminary conversations with lots of different organizations and lots of different community groups about the domains that are part of what makes up an equitable data system. Please don't feel that we, think all of these domains are applicable to all of you, or that there aren't domains that you may want to include in your data equity goals that aren't on this list. This is not intended to be either exhaustive or limited. We will work with all groups to anticipate their goals and to try to reach the communities that you are working with. But these are some of the ones that we anticipate should be included in a resource that is truly equitable in the data. And so we are preparing with experts across each of these communities and areas to understand what those measures really look like and how to best incorporate them into different types of data sets and data collection. These as well, not an exhaustive list, but we've been already hearing from community members about the kinds of challenges that they're anticipating or already encountering as they work toward their own data equity goals. And so we have been very deliberate in thinking about the types of resources that we want to find under each of these topic areas, as well as bringing into our consulting bench experts who already have experience and who know how to work through the challenges that you may encounter in each of these different areas. This list may grow. Our resource library of topics is, we absolutely are prepared to expand as we learn more about everyone's needs and what is most useful to them. But if you look at this list and you're already thinking, yep, this is an area that I am already seeing challenges with, I want you to know that we are going to be ready and putting together really great information for you to use for each of these types of TA. But again, if you don't see your particular challenge on this list or what you think is coming down the pipe, we still want to have a conversation with you about your goals and about your needs and see if there is anything that we can do, because we're all going to learn from each other in this process and build out these resources to be useful broadly. These are other examples of topics that we are anticipating, and again, prepared to tap our bench of consultants to work with you on specific to your needs. So the application process is starts with our website. We were asked some basic information about your organization, who is involved with the project, and who we should be communicating with, what your goals are, because again, we recognize and we understand that not everyone's goals are going to be the same, and we do not intend to be prescriptive. We intend to be helpful to, even if that's imagining your goals, understanding what your goals should be, crafting your own goals for your organization, as well as then understanding it and understanding what the implementation phases to achieve your goals will look like. We want to understand how your progress is going to be measured so that we are all aligned with working toward your specific goals. Ask you what specific tasks, if you know already what you think you need. If you don't, that's okay. That's what part of the initial conversations are going to be like. And then your project timeline. Through this process, we will have some meetings to really try to understand the full scope of the project. And then we will try to match you with the best team of folks on our consultants bench that can deliberately assist with your specific needs and projects. Again, that information is all available on our website, and so you can fill that out. The email comes directly to me, and that will start the process of engagement with us. So I just said a lot, but I already see that there are quite a number of comments in the chat. So I'm going to ask my team members to start reviewing some of those questions and let me know what Dr. Ponce and I can answer for you. Sarah? Oh, I see. We have a lot of introductions on the chat. Thank you very much. We understand that we had a lot of interest in today's webinar. And I see, gosh, we have people from all over the United States checking in with us, and we are excited to learn more about each of your projects and each of the goals that you all have for your organizations and for your communities. Are there any questions in the Q&A, Tara? Yes, this is being recorded, and we will edit out the challenges we had at the very beginning. And then we will post this on our YouTube channel, and it will be available broadly for you all to share. And there will be a follow-up email to you. Please, Tiffany, correct me if I'm wrong. When the communications department is done and has it posted, you'll all get notification of where to go find that, so that you please do feel free to share it broadly. So we are offering, again, a small package of technical assistance hours that is supported by our grant from the Robert Wood Johnson Foundation. And so there will not be an upfront cost, depending on the full scope of your project. And if there was something beyond the initial ask that you wanted to continue with, we will put a contract in place and discuss the appropriate level of service for you, because it will not be the same for everyone. But the initial consultation and the initial work with you is being funded generously by Robert Wood Johnson. And so please don't let fear of cost be a reason for you not to reach out to us if you think that you can benefit from our services. I believe, yes, that our fabulous communications department, along with the video, will make the slides available. Are there any other questions? Oh, questions in the Q&A. Let me see.
Hey. Sorry, back here. I also first, before we get into that, I wanted to acknowledge the people in the room who you can't hear because we silenced them with all the reverb. We have Barbara Fernandez from NORC, Lacey Hartman from SHADAC, Jamie Kim from Access, Jenna Lecomte-Hindley from Health Assessment and Research for Communities, or HARC. We have Sung-Hee Lee from the Institute for Social Research from the University of Michigan. We have June O'Leary from California Pan-Ethnic Health Network, and Megan Ray Novak from Case Western, Golene Samari from University of Southern California, Amanda Winters from Cardia, and Lindsay Whittington from Colorado Health Institute. So this launch is synchronized with meeting with our technical assistants bench, and they are here in the room. Sorry, you can't see them or you can't hear them, but they are here. So on the thoughts on category of race and ethnicity, that's, I think, that's a longer conversation. I think it depends on like what your needs are, and also like geographically, there may be some different levels of granularity that you may want to collect. I do want to say that when the Office of Management and Budget put together a call to Federal Register to give their thoughts on the revisions, the pending revisions for OMB Directive 15, the federal standards for collection of race and ethnicity, that the Center for Health Policy Research did submit 3 different conceptualizations of how race and ethnicity should be collected. One from an operational perspective from the California Health Interview Survey, one from the Native Hawaiian and Pacific Islander Data Policy Lab, which is part of the center, particularly focusing on the smallest racialized group in the United States, and one from the Data Equity Center. So I think it's a combination of what is it that your needs are, the population that you're serving, and also I think then what the capacity is of your organization. So I'm sorry, I hope, Kelsey, how section of data is broken down, if they're together or separated. I'm not quite sure if that's like the going from the 2 question to the 1 question. That may be what you're asking, like from the Latino Hispanic first question on ethnicity to the proposed combining into 1 question. Again, I think it depends on the population you're serving, the geography, the jurisdiction. So the next question, could you give examples of your services? Okay. Sorry.
So as I mentioned earlier, we are just now launching. And so we are not being rigid about the things that we anticipate doing. We have provided some resources to certain organizations that have already reached out to us. For example, we produced a 2-pager on the importance of data disaggregation for an organization to use as they are working for legislation in their state to try to improve at the state level the racial and ethnic categories and improve the disaggregation of those from a state law perspective. So we are not setting out a rigid list of and because we want to talk and really understand sort of what your needs are, but that could be producing a tool, producing resources, or just working with you all to talk through some of the challenges that you're encountering, whether they be practical, technical, methodological, to again just sort of meet every organization where they are in the challenges that they're having. And so we are not limited. We may get a request that we don't feel like we could handle, but as of yet we haven't heard one of those, and so we anticipate trying to be as flexible as possible for any of the needs that we get requests for. So I'm sorry that's not a great, I didn't provide specific examples, but I hope I answered your question in that we want to hear what your needs are and really try to put something together that can be very helpful to you. Will we be accepting applications throughout 2024? Absolutely. It is already live on the site. You can submit one today if you like and start the process, but we will absolutely be carrying this into next year and look forward to hearing from a lot of you that are joining us today. The next question is, how can we contribute to the database and or as a TA team member on special topics we may have expertise in? Drop me an email and we will talk about that because this is again, a community that we are building and that we are looking to build on. We don't want to recreate the wheel for anybody if others have already been down the path and already come up with really great solutions and expert ideas and tools and resources that others can benefit from. And so we are happy to hear from you and look at what it is that you feel like would be of benefit to others, and to consider that as our resource. And we appreciate your reaching out to offer that kind of assistance, because we are just a big community all trying to move together, and we can all help each other and really benefit from work that's already been done, and we should. The next question, a population that is particularly difficult for us to get data on for obvious reasons is the undocumented population. Is that something that we have insights on? Yes, we do.
Hi. So yes, I think that question gets at both the inclusivity of the collection of the data and ensuring that the way we ask the questions do not jeopardize the person that we're collecting the data from, assuring them that there is protections. For example, in the California Health Interview Survey, where it is a population-based survey, that we have this preamble about we'll be asking about immigration and citizenship status, because the purpose of the survey is to inform policymakers to improve the health of all Californians, health for all. And we will not be reporting any of this data to immigration authorities. So I think part of it is from the preamble, the question wording, and to the in some cases, for example, in the California Health Interview Survey, there were some waves of the survey where we asked about visa status, we asked about DACA status, deferred action for child arrival status, and we also asked if it had expired. So there's like ways of asking that we don't point out, say, are you undocumented? So that's one example, is the question wording. The other is that sometimes some inferences and modeling happen post data collection. And so we have a variable asking about, are you a non-citizen without a green card, where some researchers have used that as a proxy for status of somebody who is undocumented. But there's also some modeling approaches that we can suggest, but both from the collection on how respectful and how non-stigmatizing it is, to perhaps some post-collection estimation, and to tabulation, that we do have some expertise in that.
And so I hope that was just a great example for all of you about the kinds of information that we have the ability to tap into, both from our own experience at our center, as well as from the bench that we have assembled. So yes, bring us your topic areas, bring us your the populations that you're interested in, because if we haven't done it ourselves, one of our partners may have done it, and if none of us have done it, we will collectively work on how to achieve getting at the population that you are particularly interested in. So I hope that answers everyone's questions about the types. If we're not the experts, we're going to find it. It's kind of like what they did in Miracle on 34th Street when Macy said, if we don't have it, we're going to tell you where to go find it. So that is our goal. We hope to be able to be that for everybody in every topic that comes with us, but bring us your challenges and we will work toward them together. Who qualifies as an applicant? That is broad-based. If you have, we ultimately, obviously, as the Center for Health Policy Research, we are very mindful of the important role that data plays in healthcare, health decisions, health policy. But we also recognize that there are so many areas that feed into social determinants of health that we are not strictly focused on only narrow health-related data sets, because we recognize that housing data, that employment data, that labor data, all is an important data sets that get overlaid with, that get connected to, that get linked to, that inform health outcomes. And so we are fairly broad-based in terms of the types of data that we believe we are prepared to help with, and the types of organizations that may be working with that data. And so please reach out, and if we are at all able to, we will definitely try to make a connection for you. Although we understand your application process, is there an expedited process if we need certain data more immediately? It depends on what it is and what it's going to take to get it. So please just reach out, because I don't know, but we're happy to try to be as helpful in as expedited a process as we can, if we are able to do that. I see a CHIS related question, and I'm happy to direct you to our website. And there is a lot of information there on CHIS, on who is included in the survey, on who gets represented, what data is available through our fabulous online query system, the Ask CHIS system. And there are other data resources on the site that can help you answer your specific question about any of the information that is in the California Health Interview Survey. But I do want to say that we are not trying to make everybody look like the California Health Interview Survey. So we are going to meet everyone else where they are. But if you're looking for great data on California and our very diverse population, I do direct you to the California Health Interview Survey, all information available on our site.
Can I just say something about that? Sorry. So, so we don't, as AJ said, Dr. Scheitler said, is that a probability-based household sampling frame, which is what CHIS is, may not be the best medium of collecting data on the population that you care about. So we're not bound by this probability space necessarily of a household sample. But on CHIS, is that we do have ways of getting at the unhoused population by prepaid cell phones. So like we think about, okay, who's excluded, where's the systematic bias? So we have that perspective, but I also just want to emphasize that it's not our model that's going to be the one that's going to perpetuate. It depends on your needs.
Thank you very much. I see a question here about whether or not we will provide assistance and resources with educating employees of organizations to ask demographic, personal information from members of the community. We are already hearing requests for this from a lot of different places, so we absolutely anticipate creating as necessary, both resources that we can hand off with you, but potential trainings around this information. We'd love to hear from you and hear specifically what your organization's setup is and who those folks are in your group that you would like to see trained, because that will help us as we're designing that program and those resources to be responsive to you. But I feel very comfortable saying that this is a common request that we are hearing from organizations, and so we absolutely anticipate working in this space.
I can answer.
Mr. Cruz's.
James Cruz asked, collecting data from indigenous groups from Mexico, specifically Mixteco community who are in non-Spanish speaking and there's no written language. Thank you for that question. I think that that's something that we're pondering right now in CHIS and with our Multicultural Technical Advisory Committee. I can say that that is not a strength right now, but it's something that we are thinking of, and also expanding the bench and ensuring that we have that expertise. I'd imagine it would have to be a both in developing questionnaires that are so there's no written language, and also the sampling frame. So we will help, but we are trying to expand our bench to make sure that that is available if that is your need. And Tara Becker's typing an answer too, so I see.
Thank you. There have been a few remarks in the chat that have been asking about the process and timing on the process. So we're officially launching today, and as I mentioned, we have a lot of interest. Hi to a lot of you out there across the country joining us today. Timelines are not predetermined and finite. We are going to review what your goals are, what your project timeline is, and what the bandwidth is at any given time among the folks that we are working with and that we feel like would be most appropriate to work on your project. And so the timeline is not something that's already pre-established or set in stone. It's something that would be worked out together with you in consultation and in understanding what your project is, what it's going to take to help meet your TA requests, and then again, what our resources are on our side to be able to help you, hopefully within a very timely manner. But it's not something that it's something we hope to be flexible with you on and work out something that works both for our partners and for your project as well. So our initial timeline, I hope to be responsive to the requests that we get, within a week's time. Hope to get then an initial meeting scheduled within a few weeks' time after the initial request is made. But in terms of the actual project timeline, once we understand whether or not we can help you and who the appropriate team is to help you, that is something that we would work on an individual project basis with you on. A maximum number of projects. we hope to be, you know, inundated with requests. And so there will be a finite, as all of us, I'm sure, on this call are. We're all very busy. We all have a lot of projects, and so we don't have that number in our head. It depends on the types of requests we get, and that's also why we are very focused on, with any project that we do take on, that if there's anything that we learn from it that can be shared with others as a case study, as a publication, as a tool, as a training video, that we will develop those resources so that if we are getting inundated with too many requests that we can handle at any one time, we're still very cognizant of putting together, you know, things that can help everyone in the interim until maybe we can get around to it. We have a certain number of hours that all of our teams are dedicated to this, so it's all going to depend on the kind of demand that we have. Is there a timeline in place? So we are funded to provide this TA through 2024, and so that is at the moment the timeline that we are working on for offering our services. Are there any other questions? Tara, am I missing anything from the chat? Oh. Absolutely. Obviously, we are biased because we are in California and we're very familiar with this space here. But as you saw from the bench that we have, we've pulled folks from across the country, and we also at this California, the Center for Health Policy Research, we do work in other states, and we pay attention to policy in other states. And so we will be doing that not only for organizations in California, but for any organizations across the country that have similar requirements within their own states. Again, each project, we want to understand what the goals and the parameters are for those individual projects. And so we will be prepared to adhere to whatever standards are being applied to the projects that we get requests for. We are a lot of fun. We have a lot of great people that we are working with. And so we welcome even inquiries if you're saying you're not sure yet. We would love to hear about the needs, again, so that as we go through this work over the next year, even if you're not ready now for TA, we can start to build and anticipate the types of resources that we will want to be including. And we hope that you will check back on our website frequently as we build out that library. We hope that you will reach out to us with requests for resource development, for things that you wish you could find somewhere and that you think that we should be including under this umbrella. And we're happy to add you to our website, our listserv, so that we can keep you updated about projects that we have, about trainings that we're going to be offering, about new resources that we've developed, so that you can remain abreast, so that if you're not in the market today for these services, but a year from now you are, that you will be up to date on the types of things that we have to offer. And we hope that you will look to us as the first resource to find the information that you need, and reach out to us in case you can, and let us know if there's something that we need to be adding.
I had another. Sorry, we're also not only are we fun, but we kind of think quickly. So on that question about Mixteco and indigenous populations, I'm already thinking two folks from our bench could help. The California Pan-Ethnic Health Network, which works with a network of community organizations, frontline community workers. So thinking about the community assessment piece, community connection piece would be one of the consultants, and also Dr. Sung-Hee Lee, who is from Michigan, who is a national expert on something called respondent-driven sampling design, which is kind of, at some point we get towards a probability space. So I think that there's, in thinking about like, give us your the needs that you have, and then we can come up with assembling a team. I think I also want to emphasize that often data equity is aspirational, or it's insurmountable, or it's the impossible. But the whole purpose of this project is that just with a bit of technical assistance that we can really push you to making it so. And I see Darina Wong has a question. Yes, I guess, yes, but they'd be on the listserv, right?
No, I don't add them to my listserv for this specific project unless you request it from me. I don't want everybody to think that I'm going to start spamming you, because I'm not. We do have a center listserv that you can also be added to. But if you're interested specifically in updates about this project, please drop me an email. And Dorina, I know you have my email, so please just reach out.
Bye, Dorina.
And I will make sure that you get updates as appropriate. The link to what?
Sign up. Oh, they want to sign up for the listserv.
Oh, sure. Tiffany, can you drop my email address in the chat? Okay, fantastic. Well, if there's no other questions, my email is now in the chat. Feel free to reach out anytime with any additional questions, as now we have planted this wonderful project idea in your head, and you're going to be thinking about the kinds of things that you want to know more about. Please drop me an email, or please go to to the website and send an inquiry, and we will be as responsive as possible, and look forward to hearing from all of you and working with many of you in the future. Thank you very much for joining us today.
Thank you. And say thank you. Say hello.